Hi, I'm Sarah from Venus Wellness. Today, I'd like to talk about how I think when I am treating people osteopathically. Osteopathy was developed by Dr. Andrew Still, more than 100 years ago. It's a system of manual adjustments that help to restore better alignment to joints and better function to the joints. The principles of osteopathy claim that physiology and anatomy are interrelated and interdependent. For example, you could have a back problem, right? An inflamed SI joint on, say, the right side that could, over time, cause a colon problem on the right side, say the ascending colon or the cecum. So those are the premises of osteopathy. Everything's interrelated. As well, it also believes that the body can self-heal, even self-adjust. So, we, as osteopaths, we try to help the body self-heal. Just by giving a little bit of impetus, aligning things, releasing things, the body can then function better. So, what does that even mean? Well, when I look at a client that comes in, every single time I see them, I assess the spine and I assess the major joints, hips, shoulders, and any other joint that they may be complaining about. I see if there's restrictions in motion, or if there's a favor, maybe favoring right rotation or left rotation, and I try to bring balance just through releasing excess muscle tension, trying to increase suboptimal muscle tone where it's too weak, and getting just general better motion of every joint. Now, there is a reason for that. I'm not just trying to get the joints moving. The whole point of it is to normalize the reflex arc. Now, the reflex arc, at every spinal cord level throughout your spine, any level, T12, L1, C7, they all have a reflex arc. So we have sensory nerves that come into the dorsal nucleus, and we have motor nerves coming out of the ventral nucleus. When you have the sensory nerves sending the impulses in, those neurotransmitters will go around the reflex arc, and some of them will rise up and go to the brain and report pain or dysfunction in a certain area. Some of the neurotransmitters will continue to go around and get into the sympathetic chain, rising up or down the sympathetic chain, causing a different type of response, which is more sympathetically driven or autonomically driven. Could cause a release of adrenaline, things like that. And some of them will go back into the motor chain, causing excess muscle tension on the arc of the sensory nerves that are reporting back. So when we are, as osteopathic practitioners, trying to stretch a short muscle, the reality is, in my opinion, we're not trying to stretch the short muscle. We're trying to release that muscle so that its opposing muscle or its antagonist can contract better. Therefore, the sensory and motor impulses at that level are more balanced. That's my thought. So, in shortening a long muscle or lengthening a short muscle, really, you're not trying to just balance the muscles. That's just a way into the reflex arc. We're trying to establish a normalization of the expression of the reflex arc so there's better balance. You don't side bend like this all the time, but you can't go the other way, that kind of thing. All the organs on that reflex arc will also be affected because as the tone comes down in general and the body's more relaxed, those organs can then function more optimally. The blood will be flowing better. The reason I try to normalize the reflex arc, try to balance the sensory and motor function, is in order to help the global communication systems function better. I perceive global communication systems as the nerves, the artery, the veins, and the lymph vessels. Those are the systems that go all the way through the body, right to the endpoints and back. As far as anatomy as well, there's also fascia. Fascia covers every single piece of human anatomy and communicates in mysterious ways we really don't understand still to this day. So therefore, we see a lot of people doing myofascial release work because we know now that when the fascia relaxes, a lot of other systems on that reflex arc start to function much better. Well, as an osteopathic practitioner, I try to get soft tone throughout the whole body so there are strong pulses. Anywhere I go to feel an artery, I expect a nice, strong, calm pulse, not bounding, just calm and even pulse. I know that if I can establish that by releasing all the soft tissue and adjusting the hard tissues like the bones and joints, then I also know that the veins and the lymphatic system alongside that artery are draining appropriately, allowing fresh nutrients and bloods to come into the area, feed the tissues, and help the body heal itself. This is my thought process when I'm treating osteopathically. And so even though I may be kind of activating muscles or stretching muscles, more often than not, I do quiet work like neural inhibition, as well as balanced ligamentous techniques, trying to release calcified or fibrosed ligaments that might be adhered to different tissues and restricting joint spring and joint motion. All of that, looking to soften all these areas to allow the venous and lymphatic fluids to flow freely and easily, as well as the arterial fluids and the fluids inside the nerve conduits themselves. Once those four systems have free-flowing access from center of the body to the extremities and back in, now the body is much more able to self-heal and self-adjust. Therefore, people get better. Now, I was thinking about alignment and neural function way back in my Pilates days, because back then I understood that as soon as somebody had better alignment, if they came in tilted like this and having their head twisted and complaining of chronic migraines after a car accident, I didn't understand the physiology. I didn't know why they had that, but I knew that if we could at least just straighten out the central axis for the spinal cord and brain, there should be some improvements. 100% of the time, these people improved. Same with lower back pain and every other type of condition that I dealt with while I taught Pilates. I'll show you a book. I wrote a book in 2003 because I knew I was doing something a little different with Pilates. And I eventually realized it is because of the assessment process that I get good results. I had developed my own assessment process because I didn't learn any of this when I was studying in Pilates. So here's the joint alignment chart I had developed. And you can see how we talk about chin pokes and, things like unleveling of shoulders. Then I also developed a pain assessment chart, so they could point and tell me what hurt where. And then I believe a range of motion chart. There was a range of motion chart? Oh, it's right, actually, it's right with the pain assessment chart. So you see spinal range of motion and different things like that, and I was noting whatever pain they felt in the very specific ranges that they felt them in. And based on these findings, I put together a Pilates program to balance out the musculature in form and function. I also felt it was very important to train the mind along with the body, because I believe that if you're thinking about your irritating boss or neighbor or your fight with your loved one, you won't be focused on yourself and your wellness, and you will not improve. You won't be able to concentrate on what we're doing and get the proper recruitment patterns when it comes to muscle function. So for me, Pilates was a mind-body workout. And I felt that connecting the mind to the body such that the individual can feel the muscles connect the right way, can feel the hypertonic muscles and get them to release just through thought, I felt people would improve dramatically, and so they did. Now, some 20 plus years later, I understand why they improved. Because after studying osteopathy, I realized that once the neurovascular system had been freed up and balanced out, there were no more kinks in these little tubes that carry all this fluid out to the ends and back. They were nice and straight the way they were supposed to be. So therefore, the fluids flowed easily, and the body was able to self-repair and self-adjust quite well. So, those are my beginning thoughts on osteopathy. I sure have a lot to talk about, so stay tuned. The next time I come on, I'm going to be showing you how I assess and I treat somebody. It will be my son. He's in the army, so he's been beaten up real good. So we'll show that one. So stay tuned. All right, well, bye for now.